So this idea of a paperless NHS is something that's not new. The NHS have tried to do it before, but one of the biggest problems that we had at the time was we didn't have the portability in devices, we didn't have the mobility, we didn't have the interoperability. And today, really, interconnectivity is going to be the biggest thing to challenge the NHS. I think in addition to interconnectivity and actually having something that will bring all these systems together, it's a fact that most of the time the NHS have done things in stovepipe projects where they've just developed things for a department, for a system, etc., etc. And really one of the biggest challenges will be looking at things enterprise-wide across the whole of the NHS or across the whole of the NHS trust that's involved. So the key benefits for a paperless NHS, as I see it, will be actually having the right information at the right place, at the right time, on a device that the user wants to receive that information. That's for a clinician, from a nurse to a doctor to a surgeon, for example. Having that information at the point of care when they need it is vital for them. For a patient, of course, the clinician having that information at the right time, at the right place, in the right device, or the way that they want to receive that information, means that the patient gets better care, better treatment, and can leave earlier. For the whole of the NHS, or for the whole of the organisation, somebody having that information at the right place at the right time means that they can share that information, and actually everybody can have access that's appropriate to have access to be able to see the right information when they need it. That's a really good question. So in terms of what things that they need to be able to upgrade and update, things like having secure information, making sure that information is secure and ease of use is one of the critical things. So what we tend to see these days is the users will use a system that is easy for them to use, and therefore security may be breached at some point doing things moving forward. So actually making sure that the infrastructure is in place, that security is in place, and people are receiving the information in the way that they want to receive it. So ELS are important. It's great to have these events. It's good to come to venues like this. And actually having these kind of events means that we can sit down with users in an open forum situation and discuss things moving forward for them. It also means that we can share information between different vendors. So there's a whole range of different people that are here today that we can share ideas with, and we can pick up ideas. I'm not a clinician. I'm an expert in communications, but I'm not a clinician. I've been around the health service for 20 years, so I know the kind of things. But I don't expect to be an expert in clinical matters, and actually being able to come and meet people that are experts in those matters, I can share my expertise with theirs and learn many things from them.